Are you determined to heal your hip labral tear pain through exercise, but just don't know where to start? Well, dear hipster, you're in luck, because in today's video, I will share a follow-along routine that anybody could do in the comfort of their own home. The intention in this routine is to bring back function and balance, not only to our hips, but for the rest of our joints as well. So let's get into it. All right, we're gonna get into our first exercise, and I'm gonna chat while we're moving, but I think it's good to just get into the positions, and some of these we're gonna be in for a while. So I'll carefully explain how to get into the position, and when I'm in it, I'm gonna talk a little bit about hip labral tears and try not to get too preachy, but I do think it's some helpful information for those of you out there navigating this terrain. So, first movement is a supine reset. I really recommend doing this exercise before you do any movement session. It's a great way to just kind of unwind the body from all the stress and asymmetries that we get into through our daily living in this 21st century, right? So, first thing you want to do is get a chair or a bench, and we're just going to bring our legs on top as so. And notice how I have a pillow on top of this bench, because if it wasn't for the pillow, my knees would be too low, right? Or my legs would be too low. And we want to make sure that our ankles are aligned with our knees, and our knees are as aligned as our hips the best we can. I mean, we're not looking for perfection here, but we're doing our best. And for some people, if you can keep your knees kind of aligned and straight, this could be a great position for you. But if you feel like your hips are a little unstable here and the knees kick out, let's get a strap. I got the strap with a nice buckle here, which I really like and has made things much easier, but you can also just use one of the easy yoga straps and tie a knot, or use the buckle or whatever they have there. And from here, we're in the position. And I'm gonna time us here for about 5 minutes, but I sometimes sit in this position for much longer. And if you feel like the hips achy today, or the rest of the body's achy from sitting all day or doing whatever, hang out here for even longer. And first thing we want to do here is just pay attention to the breath. Where are we breathing? Is it in the neck and shoulders, and are we shrugging, or can we start breathing more in the chest and the belly and kind of breathe with the whole body? Where are our points of support? Can we feel how the hands touch the ground? Can we feel how the low back touches the ground? Is it even? Is one side of the pelvis touching the ground more than the other? And not that we need to change anything right now about it, but just paying attention and observing. Every exercise is an opportunity to learn a little bit more about your body. And I feel like I'm a little far from the bench, so I'm gonna come a little closer, and feel free to adjust as much as you need. And we're just hanging out here and there's no effort in this exercise at all. We're just allowing the body to do its thing and balance out. And one of the things we're gonna go over in this exercise is how the shoulders connect to the hips and how they could be related in some of our asymmetries and imbalances. So interlace your hands like this and play around with putting your hands above your head. And you may get some pins and needles in the shoulders, or things might start feeling a little interesting or strange, depending on how you want to define it. I'm going to bring my hands down because I don't know if the mic is getting muffled, so I'm going to bring it up. But if that felt good for you, keep your hands up above your head. And just breathe and relax. So if you're navigating the hip labral tear pain diagnosis and what you should do about it, I do recommend checking out a couple of my articles. I recently wrote another one, which is called Don't Fear Hip Labral Tears. And I think many of us, when we get this diagnosis, we don't think exercise can help because of the conventional advice and recommendations that we get. And, you know, if we never went to a doctor for our hip pain, it wouldn't be hip labral tear pain, right? It would just be hip pain. And I think you really pigeonhole yourself if you just think your pain is coming from a hip labral tear. And, you know, in the article I go into all the studies that show that a lot of people with hip labral tears never get pain, right? So that could be you, you know? It could be coincidental that you have this hip labral tear and you're experiencing hip pain, you know? And if you open up your horizons and, you know, don't get too stuck on the diagnosis and really observe and experiment and be patient in your training and your exercises, you can learn a lot more about your body and maybe the way there's other things contributing to your hip pain more than that hip labral tear is, you know, with that $1 million MRI machine that we never had before the 80s. And, you know, food for thought. I'm not, you know, one thing I don't want to do is, again, sound preachy and convince you of something, but, you know, one thing I can ask you to do is just observe here in these exercises we go over today and just pay attention and not judge, right? Keep an open mind and see where the movement takes you. So we have about another minute in this position. So keep hanging out. I'm gonna see if there's anything else I wanted to talk about. Yes, there is. Last thing, before we move on to the other exercises, is pay attention to what's hard and challenging for you, right? If a certain exercise is almost impossible to do with the amount of time or amount of reps that I recommend, you know that that's something that you're weak in, and you know there's probably some dysfunction and some weakness in that movement. So practice it, you know, practice it and note it. You know, if the next exercise we're going to get into right now is shoulder circles, because I always like to do some shoulder work before the hips just to see how they're connected, right? So in this next exercise, if the shoulder circles are really hard to do and you can barely get through it, that's something you need to be working on, even though it's not the hips, right? It's the shoulders, but that can still be a major limitation for you. So let's step out of this now. It's been 5 minutes. You can hang out there for longer if you want, you know, especially if you like it. Don't feel like you need to come out of it just because we're come out of it. And we're about to stand up. I'm gonna change the camera angle. So we're gonna stand up, but see you in a few seconds. Okay, so we're on our feet. The camera might not get my feet, but what I want you to do is to make sure that both feet are shoulder width apart. Sorry, let's make it hip width apart actually. Bring them a little bit more narrow. Shoulder width is too wide. Let's get them hip width apart and they're both pointing straight. So they're even a little bit more pigeon-toed than usual probably. We want the middle toe to be pointing straight. We don't want to be duck-toed out like that. We really want to be narrow and pointing inward. Next thing we're going to do is we're going to crunch our fingers together like this, and we're going to stick our thumbs out like that. That's the posture of the hands during this exercise, okay? And we don't want to get weak there. So we really want to make sure we maintain that during the whole exercise. And I'm going to time us here for a minute in each direction. But before I do it, let me just demonstrate what we're doing, right? So we're here. Our elbows are locked and we're out to the side, right? Shoulders get pulled back a tiny bit. And from there, we do nice circles in this direction. So let's do that. I'm gonna time us for a minute. And we're going this way. And make sure that the circle is even on the way back as it is the way forward. We don't want to make the way back really shallow. We want to make sure that we're getting as much range going back as we are going forward. Another thing we want to make sure is that we're not making the circles too small or too big, okay? There's a green zone there that we want to keep it at. In the beginning, if the neck, if the shoulders are weak, the neck might want to get involved. You know, just do your best to keep the neck down and out of it. Try to pull the shoulders back the best you can. That'll get better in time. What we definitely don't want to do is flare the rib cage during this, right? So look at a mirror to the side of you to make sure you're not doing that, okay? Keep the shoulders retracted, get a nice posture throughout. So that's 1 minute. Now what we're gonna do is we're gonna flip the arms this way. Let me face you again. And we're gonna go in the other direction now. And breathe. This might get hard. This might get achy. And for many of you, this might be it for today. And that's okay. Work your way up. Joints stack on top of each other, and the shoulders and the hips are the two most mobile group of joints in the body. So if the shoulders can't help and can't keep you upright, the hips are gonna have to compensate, and that could lead to hip discomfort, right? So we wanna make sure our shoulders have good stability and have good relative strength. If you can't get through 20, 30 seconds of this, that's a sign that your shoulders are super weak, right? And need some work. So let me just show you this from the back here. Same thing, right? Keeping nice circles throughout. And that's 2 minutes. Now, if that was really hard for you, incorporate it into your practice, right? Just don't try to get that minute right away. Work your way up from 30, 40 seconds, and eventually you could get to a minute. So let's move on to the next exercise now. All right, the next exercise we're gonna do is called the L position on the wall. And you wanna get close to a wall. And for me, I have these pillars here of my rack. So for you, you could probably just jump up and place your legs on there. For me, I'm just gonna use this to help me get my legs up. So in the beginning, you wanna scoot yourself up to a point where the butt is right on the wall. At least we want to test if we can get there, right? And most of you probably won't, and this will probably be pretty challenging. What's gonna most likely happen is the butt's gonna come off the ground, or the low back's gonna come off the ground, or the knees might bend and you might not be able to lengthen the knees. So what I want you to do is I want you to scoot back from the wall as much as you need. And from there, you're going to get into a position where you feel like you can comfortably hang out for a while. Keep the knees pointing straight. You don't want either knee pointing out. And from there, what I want you to do is bring the toes down. And it doesn't have to be a crazy toes down. I just want you to have a little bit of an emphasis there with the toes down. And most importantly, we want to start squeezing and contracting these quads. We want to start feeling what that feels like for us when we try to contract the quads, right? And it's important for this position, even though you might feel some stretch in the hamstring and the calf, we want to start feeling, and I'm going to actually start our timer now that we're in a better position. We're going to hang out here for about 4 to 5 minutes, okay? And what we want to start doing is, even though the hamstring and calves might be pulling, we want to get the other side, the front of the hip, to work as well, right? We want the quads and the shin muscles to really start activating for us, okay? Because if the quads can't flex and the ankles can't flex, then, you know, how are we walking and how are we holding ourselves up all day? Probably just falling into the back of our hips, right? And into our heels. So this is a way to get better at flexing not only the hips, but really the whole lower body, right? So another thing I want you to pay attention to is, what are your hips doing here? So what I want you to do is take a look down at your pelvis. and your belly button. Belly button should be pointing directly toward the ceiling. And while I'm talking here, I want you to continue trying to flex the quads and shins, right? And if you feel like your pelvis is rotated in one direction or just hiking in one direction, I want you to try to pull the hips and the pelvis into a better position, right? Into a more neutral position. You want the belly button. What do you have to do with your pelvis to make sure that the belly button points directly at the ceiling? And that might change the stretch for you a little bit and change the position for you a little bit, and that's okay, right? And just trying to pay attention to what do you have to do in order to get that pelvis to be neutral, and what do you have to do to get the quads to contract, to pull the toes back and get the shins to contract a little bit. Another thing we want to do is totally relax the upper body, right? If I wasn't holding this mic in my left hand, my left arm would be doing what my right arm is doing. I'd just be relaxing like that. Upper body is as relaxed as it can be, and we're letting the lower body do all the work, right? We're letting the quads and the shins flex, and we're really trying to get the most out of that. And if one quad is a little harder to contract than the other, again, that tells us something about our body, you know, it tells us something about our hips, and it tells us something about what we should be looking at in other exercises and what we should be trying to improve, right? Both quads should be able to contract evenly. And also, I'm about a few inches from the wall, right? So don't think that you need to be in the exact same position as me here. Feel free to move back or forward as much as you need. But what's really important is that this low back stays flush against the ground. We got about a minute and a half here that we're gonna stay. So back to the breath, you know, once we're relaxed in a good position, we're still pulling the toes back, we're still trying to squeeze the quads, but where can we find a little bit of calm in this position? You know, even though this could be hard for many of you when we first start, especially, you know, the 3 cues that I mentioned, the ankles back, the quads, and the pelvis in a neutral position, we still want to see where can we relax even more? Where can we relax the upper body? Where's the calm in the storm? We don't want to be so tense here and like really, you know, making this really hard for us, you know, and really stressing out the nervous system. We want to only engage and activate the muscles that we want to. You know, we want to build that neuromuscular connection, have some control over the muscles that we want to contract and the muscles that we want to relax, right? And if this, for now, you know, we're about 4.5 minutes in now, we only have about 40 seconds left. And if you're still getting hamstring and calf only, probably move back even further, right? How can you make this even more of a quad dominant exercise? And that may require you to do this a few times. You know, the next time you do it, try to get more quads. The next time you come in, more quads, less hamstrings. And don't be disappointed, you know, that you didn't get it today, because you'll get it next time, right? Make a note in your journal or something that, you know, too much hamstrings this time, next time more quads. So, you know, these are all things that, you know, it's kind of part of the journey, you know, part of the discovery process. And, you know, when we take control over our hip symptoms and we don't just think it's a labral tear and we need to get surgery, and we become more responsible for our own movement, these are the things that are super important to observe. So we're done with this exercise, and we're gonna meet you on the other one in a few seconds. Before we get to the next exercise, if you're liking this video, please hit the like button and hit that subscribe button. It goes a long way for me to keep providing you with quality content. Okay, this next exercise is called the hip twist. So we're gonna lay on our back, and let's do the left hip first. We're going to make sure we're in a good position, right? So keep the feet about hip width apart. From here, make sure that you're in good alignment, right? Make sure that one thing you can do is put your middle finger on your hip bone and the thumb on the bottom of your rib cage, right? And do that on both sides of your hips. And that could already tell you right now
whether the pelvis is level or whether you're hiking to one side, okay? And that's gonna be important when we get into this position, because when we get into this position, we're gonna place our ankle here. And for some people, when they go into this excellent rotated position, the pelvis is right away gonna do a weird thing, right? It's gonna shift to one side and it's gonna drop and hike, right? So when your ankle is lifted on this leg, make sure that it doesn't happen, okay? Make sure the pelvis is still level. And then what we're gonna do is we're gonna push the hip, the knee down a little bit. And it may not be a lot. In fact, I don't really care if it's anything. It might not be anything at all. But we're gonna push the hip a little bit. And again, making sure that when we do that, it's not the whole pelvis going with the hip, right? The pelvis stays neutral, stays straight, and it's just the hip. And from there, we're gonna rotate to our right side. And we're going to place our opposite hand away. This hand would also be there, but I'm just holding this mic here. And then we're going to look the other way while we're in this position. And what's important here is we're imagining pulling this hip, this left hip, away from the pelvis, right? So the pelvis is going to the right side and the hip is going to the left. And we've been in here for a little bit, so let me just set a timer here for about another minute. And we're gonna just breathe here. Imagine like that hip is opening up from the pelvis, right? Like you're kind of pulling the two structures away from each other and wringing out the hip, right? Ideally, you want this knee pointing directly at the ceiling. It may not happen right away, right? You might be down here at first. That's okay, but see if you can pull it out a little bit and just to see how that feels for you. And with each exhale, see if you could imagine that hip detaching a little bit more from the pelvis. Okay, that's time. So slowly, let's come back to neutral. Drop both feet. And now we're gonna do the other side. So check, make sure, check the pelvis check, right? Ankle on the knee, pelvis check again. Drop the hip a little bit without twisting the pelvis. And then we're gonna rotate to our left side. Drop both knee and hand, and this hand's gonna come here and relax. And the left hand, I feel like most of you at home are probably not holding a mic, so you can drop it to the side as well. And now we're gonna breathe. Again, imagine like this right hip is getting wringed out. Maybe it's wrung out? You know what I mean? And getting detached from the pelvis. And another important thing to pay attention to is how does one side feel different than the other, right? If one side feels just like a normal position and the other side feels like there's a lot more going on. I know for myself, the right hip is my problem hip, and I know it's also really limited in external rotation, and I've always felt the stretch much more on that right side. It's getting more even now, and you'll notice that, you know, as you do these exercises more often, things will even out, but in the beginning, it may not feel so even. And I really like, for people, you may have tried external rotation with other exercises, but I really like starting with this one because it's a great way to get introduced into external rotation, because you get to hang out in this position for a while, and it's accessible to anyone, right? It's not just some of these pigeon or clamshell exercises that can be really difficult at first for many beginners, right? This is a way to gently and safely start introducing hip external rotation to your body, into your hips. And again, just breathing, relaxing. Nowhere to go. Let the hip do its thing. So let's slowly come back. And that's the hip twist.
So we're gonna end the routine with an exercise I really like. It's called the supine hip flexor combo, or just hip flexor combo. So you're gonna need 2 towels here, okay? So we're gonna roll it up. We're gonna roll up both towels. And the setup is a little tedious, but it's worth it. So just do it. I know at first I was pretty lazy with this too, but once I started doing it and saw the value, I knew that it was worth it, okay? So 1 towel will be kind of here by your low back, and I'm also gonna do another towel up here. So you can do this with me, or if you're watching this video for a second and third time or whatever, just fast forward, unless you like watching me roll up towels. Okay, so that puts us at a good spot there. And adjust this as needed for yourself. I'm gonna drop here. I'm gonna bring this over.
Sorry, I just changed the camera angle, so if that was weird, I just came back. Okay, now we're gonna grab a yoga block and put it between our knees. Okay, so let's check the feet. Make sure they're pointing their hip width apart, middle toes pointing forward. Place the yoga block between the knees, and we're gonna have 1 towel under our low back, 1 towel under our neck. Then we're gonna place our arms to the side and relax and breathe. And we're gonna squeeze now the yoga block with about 20 to 50% effort to start getting those inner thighs and hip flexors to contract. And you're gonna stay in this, and I'm gonna be doing some things here as I chat, but you stay in, keep that squeeze, and stay in this for the time period we're staying in, about 8 to 10 minutes. Let me set that timer now. So, as we're in this position, what the towels do and what our feet do is put our body in alignment for the first time, probably in a long time, right? I know the first few times I did this, it felt like I was twisted in this position and it felt strange. But pay attention to how it feels for you, because those strange sensations may actually be your body finally getting into alignment and figuring it out, right, for the first time. Maybe your inner thighs start going crazy already because your hips are usually out and your feet are pointing out, and you never use these really important inner thigh and hip flexor muscles for stability, right? So 10 minutes might be long for some, and maybe 5 to 8 minutes, but you want to work yourself up to that, because again, we're sitting all day, we're doing whatever we're doing with our shoulders and our upper body and our lower body, so we're not in alignment, right? So giving your body an opportunity to just relax and for a prolonged period of time to be aligned, right? And really start understanding what it means to be in this position is super important. Notice how your body feels after this, right? After you get out of this position. And maybe your hip feels it's one routine, right? It's not magic, and it's not gonna change the world and probably get rid of years and years of a pain pattern that you had, but maybe just you feel a little bit better, you feel a little bit more stable. The hip feels a little bit better than it did before, and imagine what a daily comprehensive movement practice would be like for you, doing this every day. that's what it takes, right? I think for a lot of people, we do so much damage to our bodies unconsciously every day with our sitting and our computer work and all that unfortunately for many of us who are out of alignment and who've done some damage to our bodies and have chronic hip pain, we need to start giving our bodies some love. We need to start coming into our bodies once a day. And if you felt pretty good after this workout, imagine what you would feel like I said, for days and days of doing this or months of doing this. And maybe it's not surgery or injections or acupuncture or no gluten or whatever that your body and hip needs, but movement, movement and safe and gentle movement, like kind of the routine we did today. Obviously you want to, sometimes I think there's misconception of like, yeah, I exercise and, I don't know why my hip hurts, but then you ask people what they do for exercise and it's like CrossFit, right? Or it's like running crazy amount of miles. This is the stuff that will help you do those things, right? Yoga, for example. Yoga's great, but if it's not fitted for your needs and it's not gentle and it's not, customized for your individual asymmetries, then it's probably not going to do very much, right? And it may make things worse if you're going into certain ranges of motions that you don't have access to yet, right? So this type of routine is all about building back balance and function. And, for a while myself, I would do what everyone else did. I would run a lot. I would do these like HIIT workouts and just get frustrated that my hip wouldn't wouldn't feel better. But why would it, right? I'm sitting all day and I'm putting the body in bad alignment and I'm running 3.5 miles. Thinking that like I could just bounce back. Back in the day, human beings used to, move a lot. There'd be a high demand for movement. We would, hunter-gatherer lifestyle, right? Or even farming, right? You would have to move a lot, but the way to survive these days is to work in a computer. And that's okay. And I think, we don't want to push that away. We need to adapt to our existence today, but we need to give our body some love. We need to, create that balance. And I think these are the type of workouts that do that. So we're still squeezing the block. Hands are out to the sides. We got about 4.5 minutes. If your inner thighs are already screaming at you, then you could come out of this. You don't have to stay in for too long. But if you can't work yourself to 10 minutes, that'd be better, or that'd be ideal. And one thing before you leave, I'm going to drop a link at the bottom to those labral tear articles I mentioned earlier, but I'm also going to drop a link to my free hip starter course, which is a nice other routine kind of like this. And it's a little different. Every routine's a little different. That one's a little bit more high intensity, but not high intensity, but more demanding of the hips. But when you sign up for that starter course, you also sign up for my email chain. And in that email funnel, I send you a bunch of regressions to all the exercises in the course. And every exercise, every routine is an opportunity to learn more about your body and learn what you may not be good at. So check that out, join the course, join my email list. I have a new course out, Happy Hips, stuff like this, Happy Hips. A lot of routines and a lot of exercises there for you to try out and practice. So I'm gonna slowly come out of this myself, because I think the whole YouTube video is gonna be longer than I wanted it to be. But it's another 3 minutes to get to 10. Feel free to hang out here. That's all I got for today. I'll see you in the next one, all right? Hope you enjoyed the routine. Happy hips.